Good morning, my dear students. Today we will have a lecture on general correlation and usefulness of homeopathic repertory with its limitation in the existing situation, which is COVID-19 crisis running in our nation. This presentation is basically for the students who are going to have their exams in the coming months. I just want to go to the initial phase of the repertory class, that is the general introduction of repertory. I just want to remind all my students that's exactly what is repertory, the definition of repertory, the meaning of repertory, and what is the use and why it was considered as the part of homeopathy during the era of Dr. Hahnemann himself. Why this concept of repertory was developed? Because as we all know very well, that Dr. Hahnemann, who is the father of homeopathy, he also came into view that something somewhere is required which will be helpful not only to the physicians but also to the patients. Essence, a book is required other than materia medica, which will be helpful. And also, I just want to tell you one thing, that according to the advisory given by the Ministry of Ayush regarding RC30, this medicine evolved because of and after only the repertorization. So the repertory is one of the most important part of homeopathy, other being materia medica and organon. As we have also studied in the organon part, that homeopathy is formed of a tripod in which one leg is of materia medica, the other one is of organon of medicine, and the last but not the least is the repertory part. So I am going to the initial phase, like for repertory, what is the definition of repertory? In short, I just want to tell you the definition of repertory. It is just a storehouse, like dictionary, like any of the dictionary, which is having all the word meanings arranged alphabetically. In the same manner, when someone asks about what is the exact definition and what is the meaning, these two words are entirely separate. But there is a slight line of demarcation between them. So first of all, what is the meaning? It is just a storehouse, a collection, that's it. And its meaning in the two languages, one is in Latin, it is also known as repertorium, which means an inventory, and in French, it is known as repertoire, which means a company's storehouse or a table. Then we come to the second part, that is the definition. What is the exact definition of repertory? Definition which defines repertory, it is an index or a catalog of symptoms of homeopathic materia medica, in which the symptoms are arranged systematically along with the indicated medicines. But when someone asks, or a layman asks, what is the difference between materia medica and repertory, then in one sentence we can help him to understand materia medica and repertory by saying that materia medica considers medicines, the medicine part of homeopathy, in which various symptoms are given, and on the other hand, repertory, it also has medicines, but in front of the symptoms. And the last part that is more important is the medicines are present with their gradation. With the gradation, I meant to say that when we look for the words in English, good, better, best, in which good, if we want to give the marks according to the words, then good will be given 1 marks, better will be 2, and the highest grade will be given to the 3 marks will be given to the best. In the same manner, in the repertory, medicines are arranged systematically, alphabetically in front of the symptoms with their gradation. The most important part of constitution is the gradation, and it is the only part which differentiates the repertory from materia medica. Then we come to the next part, that is the development of repertory. Why was it? What was the need for the formation of this subject? Again, I want to go to the first of all to the materia medica part, in which homeopathic materia medica, it is the encyclopedia of symptoms. If we consider that repertory is not existing, then what will we be able to do? I just want to tell you in short. Like today, there are around 3,500 remedies, but what we can remember is 10 to 12 or 15 or 20 remedies which can be by heart, it can be stored in our mind, which we can remember very well. But when it comes to 50, 100 or 200 or 1000, then we will not be able to differentiate, or we will not be able to get the red line symptoms of all that remedies. Here comes the requirement of repertory. And this idea of repertory came in the mind, but obvious, our master Dr. Hahnemann. Dr. Hahnemann himself, like he was practicing on 20-25 remedies, but slowly when his practice kept on increasing, the number of remedies were also being increased. What he used to do, he used to make remarks on page, that this symptom, this medicine, this symptom, this medicine. From this concept, he thought, why not we should make such a book in which the symptoms are arranged alphabetically, and in front of it, symptoms, remedies are mentioned with their gradation. So he tried his level best to form a book, which you all very well know the name of that book, which he was not able to publish, but came in the year 1805, named as Fragmenta de Veribus Medicamentorum Positivus Seven Sino Humano Corporo Observatis. Fragmenta de Veribus Medicamentorum Positivus Seven Sino Corpora Humano Positivus. This was the first repertory which was formed by our master Dr. Hahnemann, but he was not able to publish the repertory because lack of publishers available, money crisis. So these were the factors which laid down, and due to which it was not published. But the origin and the idea came into the mind of our master Dr. Hahnemann himself. Now we come to the part, what is the use of repertory in this era? Again, I want to repeat 2 lines. That Hahnemann used around 200 remedies during his practice. At that time, he felt the requirement of a book considered as a repertory. And when we talk about in terms of today, like for example, in synthesis repertory, there are around 3,712 remedies. We can't remember all these remedies And when we take a case, and after taking the case, to remember all the symptoms of the remedies is not possible. So basically, repertory, it is the explosion of materia medica, which ultimately give birth to the repertory. So in short, again, I want to say that repertory is the arrangement of vast symptoms of drugs, which are arranged alphabetically. Symptoms of the drugs are arranged alphabetically and with their gradation. This repertory subject, when we will be coming to a practice and like internship, and when we do a private practice or such practice by seeing the patients, it helps us lot of help, which is time saving. This time saving and also bring us a group of like 10 to 20 remedies, selected remedies for a particular case. So out of 3712 remedies, your horizon is being shortened, in which there are only 10 to 18, yeah, 10 to 20 remedies. So you will give due consideration to these remedies only after you are having a thorough knowledge of repertory. But for the final selection, we again have to consult the materia medica part. This is all about what is repertory, what is the use of repertory, and lastly, what I want to tell you is the limitation of repertory. Again, I am repeating that this topic is for the final year students who are going to have their exam in the coming months. Because this part, limitation of repertory, the students will only be able to get the correct answer after going all the repertories in the subject. The foremost and the first point of consideration for the limitation repertory is strictly a repertory cannot decide a medicine, as the final decision is done by the materia medica part. Second point, it just guides us for a group of medicines. Third part, no repertory can give all the well-established symptoms, all the proved and unproved medicine up to date. I am telling about you about the present date, because medicines are coming, research on new medicines are being performed every year. But medicines which are being proved and research programs have given a green flag to that remedies are not being added in the current or the existing repertories. In the same manner, whenever we repertorize a case, mostly polycrest remedies comes out after repertorization. And lastly, I want to tell you, nozules are not presented very well in any of the repertory. And also the philosophical backgrounds of different repertories are different. Some are based on inductive logic, some are based on deductive logic. And like a modern repertory, like Murphy repertory, synthesis repertory, these repertories are based on both the logics. So sometimes it becomes a confusion which repertory is to be selected. But this confusion only comes when we are not having a proper knowledge of repertory. Lastly, I would say Indian drugs like Arjuna, like Kala Namak, Netramure, Papaya Kareka, Tulsi, which is known as Osimum sand. These are the places of these remedies in the repertory part is not very well given. And I want to tell you one more thing. The potency selection is not being mentioned in the repertory part. When we go to the boric repertory, it is mentioned, but in the materia medica part, not in the repertory part. There is nothing mentioned about the repetition of the dose, intercurrent dose, intercurrent remedies. These things should also be included, which I think will be included in the coming years. This is all for the today's class. Thanks a lot. Thank you. Stay safe, stay home, as we have to fight against COVID-19. Good day.